Pregnancy is the best experience in the life of a mother. But are you aware that there are some complications that are associated with the pregnancy? Welcome. My name is Dr. Solomon Oguta. Today we are going to talk about bleeding during early pregnancy. Vaginal bleeding during early pregnancy is uncommon, and studies have shown that it's associated with some adverse outcome in pregnancy, such as low birth weight, preterm birth, and perinatal death. Yet some of the causes of this bleeding is well known and can be prevented. And when it is detected early, it can be given appropriate treatment to save the life of both the mother and her unborn child. The following are the causes of pregnancy bleeding: implantation bleeding, cervical polyp, subchorionic hemorrhage, molar pregnancy, ectopic pregnancy, and miscarriage or abortion. They have a well-known causes that can be prevented, or it can be detected early to prevent those adverse outcomes of pregnancy. Implantation bleeding is the bleeding that occurs very early, especially around the time of conception. It occurs around 1 to 2 weeks after the fertilization has taken place. This is as a result of the embryo getting implanted onto the endometrial lining or the lining of the uterus. During that process, there are some blood vessels that are broken off and then release some blood. Implantation bleeding is not dangerous to the life of the mother, neither is it dangerous to the baby. So it is not taken as a serious problem or any complication. And once it is detected, we always advise mothers that it is not dangerous and the pregnancy can continue. Another bleeding problem is subchorionic hemorrhage. What we call subchorionic hemorrhage is the bleeding between the fetal membrane and the uterine lining. If there has been some detachment between those two tissues. There are several causes that can result to subchorionic hemorrhage. The collection of blood between those two membranes, the fetal membrane and the maternal uterine lining, that blood which is collected is called hematoma. Most of the studies has not shown the clear cause of this subchorionic hemorrhage. But once it occurs, the mother presents with vaginal bleeding that may vary in size depending on how much blood has been collected. At times there is discharge of which the color varies, may vary between pinkish to brownish, and in some cases there may be associated abdominal cramps or tenderness. But to some mothers, they don't show any sign and symptom, of which in these mothers it may become hard to detect early. But thanks be to those who come early during antenatal and then they do the ultrasound scan. Those ones that they don't show the sign and symptom, they can only detect subchorionic hemorrhage during routine ultrasound scan. So I encourage mothers, please do the ultrasound scan early in pregnancy. There are some other pathologies or complications in pregnancy that can only be revealed during ultrasound scan. Once it is detected, the healthcare provider will look at the severity and then give the appropriate treatment. The treatment depends on the symptom, the age, and other associated factors. Another complication is cervical polyp. Cervical polyp can also cause bleeding in pregnancy. Polyp is a non-cancerous growth within the cervix. There are several causes that can result into the development of the polyp. One of them is when your body is responding abnormally to the estrogen, or when there is high estrogen level within the maternal blood. It may stimulate this non-cancerous growth to develop within the cervix. Other causes could be due to infections like STDs. If you have the infections within the uterus or within the cervix or the vagina, can trigger the development of the polyp. If you have cervical polyp, you may show or present with the following signs and symptoms. There may be vaginal discharge, which is full smelling. The smelling is not all that good, and sometimes there may be associated color changes in this discharge. The normal vaginal discharge in pregnancy, it is mucoid and it is colorless. So when you see any color changes which is coming either whitish or brownish and full smelling, you have to contact your healthcare provider to see and examine you to detect which problem could that one be resulting from. Another symptom that a mother with a cervical polyp can present with is spotting bleeding, especially in between periods. And then another one can be bleeding after the reproductive age has passed the menopause. What I could say with cervical polyp does not only present during pregnancy. This one can be even when the pregnancy is not there. Possibly, you could be having the cervical polyp even without pregnancy. So when you see those signs and symptoms that I mentioned above, please contact your healthcare provider. Let you be cross-checked and given the appropriate treatment. Another cause of bleeding in early pregnancy is what we call molar pregnancy. Molar pregnancy is a pregnancy which is developing without a baby. That's what I could say. It results from the problem from placental development. Instead of developing the baby, it has been replaced with the vesicles. So here the uterus is filled with the vesicle instead of the embryo, which is the baby. Sometimes you could develop molar pregnancy not because of your fault. Other cases result from genetical abnormalities or some other associated problems. A mother with a molar pregnancy shows the following signs and symptoms. Yes, there could be bleeding. Bleeding could be there, either spotting or the size could even increase. But the notable sign when you see this one is the cyst. When you see something like a cyst or something like a vesicle that you are passing from your private part, and you have tested for the pregnancy, it is showing that you are pregnant, really you have to contact your healthcare provider. Other symptoms could be severe pelvic pain or pressure-like symptom that is within your pelvis or lower abdomen. Really, you have to contact your healthcare provider early enough, because when you delay, this molar pregnancy may transform into a cancerous state called choriocarcinoma. So when it's detected early, you can be given appropriate treatment and then you continue with normal life. Another one is ectopic pregnancy. Ectopic pregnancy can also cause bleeding during early pregnancy. What I mean by ectopic pregnancy is when the baby is developing outside the womb, outside the uterus. It could be within the fallopian tube, at times could be within the abdomen or within the cervix or another part apart from the lining of the uterus. So ectopic pregnancy is an emergency. It presents with the following signs and symptoms. Bleeding is there. Though it may be light, but bleeding is there, and pain. There could be abdominal pain. At times, pain may be localized within one side of the body, within one side of the lower abdomen. When you see such symptoms, please, especially when it is worsening, please come early, don't delay. Any bleeding in early pregnancy is dangerous. In fact, any bleeding in the whole pregnancy is dangerous. You have to get to know what could be causing bleeding really you don't have to have any bleeding during pregnancy. There are some risk factors that can predispose a mother to developing ectopic pregnancy. One of them is pelvic inflammatory disease. If you have been having infections, STDs, that has entered into your uterus and then into the tube, can cause the infections around those parts and disorganize the normal structure of those areas that really cause problems during pregnancy. Another one is if you have surgery, sometimes back around the pelvis or around the fallopian tube, it can also predispose to ectopic pregnancy. And also other sexual transmitted infection. That is really why any infection as a lady that you have to treat it early enough and then make sure that it is treated properly. Okay, and lastly, the last cause of bleeding early pregnancy is miscarriage or abortion. Miscarriage is a spontaneous loss of pregnancy, especially early in pregnancy before 20 weeks of gestation. So there are several signs that you can show up with when you are miscarrying or having abortion. One of them, the notable sign, is bleeding. It may vary in size. And then you have the cramp, the abdominal cramp that is worsening. And the other thing is you may have some pain around the lower abdomen. So when you see those things, you have to come early to seek for medical attention so that the healthcare provider will cross-check you to see. There are several types of abortion. The healthcare provider will cross-check you, determine which type it is, and give you appropriate treatment. I know there are other types of abortion, miscarriage, that cannot be prevented, but really, you first go to the healthcare provider and let you be cross-checked. And generally, I would like to emphasize on antenatal care. Please come to antenatal care early enough, because some of these things can easily be detected during antenatal screening. And once they are detected, they can be prevented from occurring or causing complications, because at the end, the complication is not good to the baby as well to the life of the mother. Thank you so much. Subscribe into our channel so that you'll be the first to know once we have something in place. Thank you.